Hello, Miss Holmes. How are you?
I'm good.
My name is Deborah, and I'm going to be a nurse today. I'm going to take care of you today.
Okay.
Nice to meet you.
All right.
So we got you hooked up
Yeah,
there.
this IV.
All right. What
Must
brings?
have been a student because she should always stick to
Oh my goodness. Well, we try to provide the best services to our patients.
that. Well, you know, I've been a nurse for 30 years.
You
so,
have?
So it's just routine.
Okay. So what brings you in to see us today?
Well, I've been having some chest pain, trouble sleeping and stuff, which is why I came in to see Dr. Walker.
How long has this been going on?
For the past 3 weeks, actually. They say I got sleep apnea, but I don't ever wear that machine.
Is there a particular reason why you don't wear it?
Yeah, you see this face?
Oh.
That thing, it leave the marks on you and stuff, and I can't sleep with that either. But it's really it's just, my chest hurts so bad when I be trying to lay down and sleep.
How often is the chest pain the last 3 weeks as well?
Yeah, at night.
Okay, at night.
Yeah.
What do you usually eat before you go to sleep?
Ooh, what I don't eat.
Oh,
Let me see. With work and stuff, I up and it takes me so long to wind down all the coffee I drink and, walking around for 12 hours. So I tend to snack and, I have to have a, cigarette before I go to bed. So.
All right. How long have you been a smoker?
Too long. Let's see. 20 years.
How many packs per day?
Per day, I smoke about 3 packs a week. 3 packs a week.
All right, Miss Holmes. What alleviating factors? What helps you when you have these episodes?
Usually with, the chest pain, I usually have to sit up because, when I'm laying down, it's so hard to sleep, and then that's when the pain starts. So I sit up. And then I've been having that hoarseness with my throat and stuff, and it feels almost like heartburn, but sometimes it feels a lot worse.
On a scale of 0 to 10, how bad is that pain?
That pain, it's usually about a 6 or a 7.
I know that we talked about your smoking. Do you drink alcohol? I see that you have a history of, you were diagnosed with a hiatal hernia 6 months ago, and you have chronic ear infections. Do you have any other medical conditions?
No, we found out about the hernia, about 6 months ago. And then I have a sleep apnea. So I have that, and then, I always have ear infection. I wouldn't be surprised. I feel like I'm about to get one.
What kind of medications are you taking?
I really don't like taking medicine. And I know I'm in healthcare and I, should be all about medicine, but I really don't like taking anything. But if I'm having a really bad heartburn, like I said, I take some Tums, or, your grandma tell you to, get your pinch of cornstarch. So I do that, and it kind of helps it.
3 hours later.
Hello, Miss Holmes. How are you today?
Yeah, just resting.
I know Dr. Walker came and talked to you about the results of the diagnosis test, and we have confirmed that you do have GERD. Okay, so I'm just here to talk to you about the kind of disease, make sure that you understand what we need to do as far as diet and as far as medicine goes. Okay, I'm going to give you this information for you to look over.
Okay.
And I'm here if you have any questions or anything. I just want to kind of talk to you about modifying your diet.
Okay.
All right, what do you eat?
I really just whatever I can get late at night. I really like, my favorite is spaghetti. I can't even lie. I love me some spaghetti. I might as well been a tag.
Okay, well, as far as the GERD goes, we're going to have to kind of avoid the tomatoes a little bit. You can maybe have it in moderation, but not often, because that is a food that does trigger GERD. Okay, and I remember you saying you were an adamant coffee drinker. So that's another thing we're going to have to talk about. We're going to have to talk about the coffee because that aggravates GERD as well. Okay, we're going to have to talk about making your meals smaller, at least 5 or 6 small meals. That way you're not hungry during the day. So we need to talk about how do you usually, we're going to talk about preparing your foods. Maybe cooking and packing a lunch so that you're not just going to fast food restaurants eating fat, greasy foods that can trigger that GERD, okay?
It's just, I understand what you're saying. I really understand, but I guess I'm gonna look over this and I'm gonna have to really sit down and think about some ways that I can change to learn how to live with this.
All right, Ms. Holmes, do you have any more questions concerning your diet or your diagnosis?
I'm gonna do right.
All right, you have your call light. If you have any more questions, just don't hesitate to give me a call, okay?
All right.
All right.
Oh, good. My Dr. Pepper. I've been waiting on this.